Drugmaker Pfizer plans to raise prices on 41 prescription drugs beginning in January. This comes after they temporarily decided to hold off on a price hike just a few months ago. This has been a key issue for the president, who has vowed to lower drug prices. And just this past Sunday, 60 Minutes examined naloxone. It's been dubbed a miracle drug for its ability to save the life of someone experiencing an opioid overdose. It can reportedly cost as little as a nickel a dose. But Axios, the easy-to-use auto injector, costs a lot more. Its price tag is over $4,000.
This woman in the back of a Salt Lake City PD squad car isn't breathing. The officer sprays naloxone up her nose with a device called Narcan, provided to first responders at nearly half price.
Stay with me.
Watch it take effect.
There you go, there you go, there you go.
In most states now, you can pick up naloxone at your pharmacy, often without a personal prescription. A syringe and vial can cost around $15. But the FDA has approved two new, easier-to-use naloxone devices specifically for people with no medical training: a nasal spray and an auto-injector like an EpiPen that talks.
If you are ready to use, pull off red safety guard.
Problem is, they're way more expensive. The spray is $125. The injector, over $4,000.
Injection complete.
Axios maker Kaleo priced the injector high to begin with, $575, and then bumped it up more than 550%.
Healthcare business reporter for Axios, Bob Herman, recently looked into the issue of drug pricing in America with a piece called The Drug Pricing Maze. He writes that, quote, the system for setting drug prices in the U.S. is a labyrinth. It can be enormously frustrating for patients and enormously rewarding for the drug companies, pharmacies, doctors, hospitals, and assorted middlemen that profit all along the way. And Bob joins me now from Chicago. Bob, you describe drug pricing as a maze and cite an example where one drug might cost $3 to make but will sell for $15. So what happens to the other $12?
Well, it goes through a very complicated maze of middlemen. A lot of people, when they go to the pharmacy, they'll pay their copay, but they don't realize what goes on behind that. That extra money goes to the pharmacy, of course. It goes to the wholesaler that delivers the drug to the pharmacy. It goes to the drug company, of course, and then there's various other middlemen that negotiate benefits and the drug prices. Some of them are called pharmacy benefit managers. And insurance companies get a part of the cut too. So it goes to a lot of different parties.
I read your article, and those middlemen are very confusing. And as you wrote, there's a lot of mystery surrounding exactly what they do and how much money they're taking during this process. So what kind of work is being done by the government or otherwise to gauge whether a drug is fairly priced?
So these middlemen, they're called pharmacy benefit managers, and like you allude to, they negotiate prices down from drug companies. They kind of leave it up to pharmacy benefit managers to negotiate, kind of leave it up to them and the drug companies to work things out. There's the Trump administration is considering changing some of the rules to those negotiations. A big part of this involves rebates. So a drug company has a price, a pharmacy benefit manager negotiates that down through what's called a rebate. And there's concern that some of those rebates, which are secrets, aren't flowing back through to patients. And so the government is currently weighing some proposals on what they should do with those rebates and how they should be viewed and who they should be passed through to. But it's at very early stages for that, and nothing might come at all from it.
In your reporting, you also point out that Americans spend a lot more on hospital care and doctor's visits than they do on prescription drugs, yet drug prices are what get a lot of the attention. Why is that?
I think a big reason is drugs. People often use prescriptions every day. You take it before bedtime. You know, I'm sure we all know someone who has taken prescription drugs. Hospital care Not everyone goes to the hospital every day, but when you're in the hospital, it's far more expensive than it is, for just picking up prescriptions at the pharmacy. So a lot of this it's very personal because you see this every day, whereas hospitals, it's not an everyday occurrence. But either way, we're still, as a country, spending a lot both on hospital care and doctor care as well as prescription drugs.
And there are drugs such as the EpiPen and insulin that are life-saving drugs that people need, and that we've seen the prices go up several fold in the past few years. That causes a lot of anger, doesn't it?
Right, it does. I mean, it's a very emotional, personal issue for a lot of people. If you're a diabetic, and you need insulin to live, there's no other choice you have other than buying insulin. And if you don't have good insurance or you have no insurance at all, insulin could really sap your savings very quickly. So for these life-saving medications, drug prices are probably your main concern right now, and that's why they're getting so much attention, especially politically.
So what exactly then can the president and his administration do to tackle drug prices as he promised? I mean, he did make a big deal out of it, but it does seem to be falling back now in terms of the administration's priority.
The administration put out a blueprint. It had a hodgepodge of ideas on what they thought could bring down drug prices. None of them have really gone into action yet. There's some that tinker with showing a drug's list price in a commercial that you see on TV. There's questions about how viable or effective that would be in doing anything with the price at all. There are other things that the administration has proposed, but none of them have really come to fruition yet. They're just in proposed stage right now. There are other items that Democrats have been pushing. The most notable one is having Medicare negotiate drugs. That is kind of anathema to Republicans, so that to kind of expect there to be a grand bargain on that kind of thing is a little bit out of reach, but that's where kind of the two sides stand. Nothing is really has been done yet, but that's where they kind of stand.
And so, Bob, how has the pharmaceutical industry reacted to all of this? Has the pharmaceutical lobby, which we know is very powerful, taken a more aggressive posture in light of these calls to lower drug prices? Because we know it's complicated. It takes a lot of money to fund the research to create new drugs that can perhaps cure cancer. But when it comes to old drugs, as you point out, that have been on the market for a long time, people have a harder time understanding why those prices need to go up.
Right. So it's a good point. There's research and development costs to any drug, and that's kind of the pharmaceutical industry's main line is, we fund all the research and development behind this. It's not cheap to find these potential cures or breakthrough medicines. But they've been aggressively trying to craft their messages. We just analyzed tax documents from Pharma, which is the main trade group for the pharmaceutical industry, and it showed that they hiked up membership dues from their drug company members. They spent a lot more on advertising, on federal and state lobbying, on just general research and political campaigning. So the pharmaceutical industry has been very aggressive in terms of shaping the narrative to what they want, which is we are innovators, we're creating these great medicines, and they're trying to lessen any criticism of the prices that they set. And obviously that's the main issue for them.
I think if there were more clarity to the pricing model, or if that model were more transparent, people would have a better time accepting it. All right, Bob Herman, thank you so much for sharing your insight with us.
Thanks for having me.